Hello, everyone. I am happy to tell you about the poster that we submitted about the causal explanations of weight among Latinas in Utah. For this population, we looked into recruitment from community health workers who, in turn, were able to locate the, the participants in diverse weight categories. And that was essential because we wanted to compare um, to see if there was any different through that segmentation of, you know, um, controlled weight, overweight, and obese, according to BMI. And so, because of all this, we were able to determine so many factors that are involved in what do the women think causes weight. What's interesting to me about this is that people say everybody knows why you get, overweight. Everybody knows, right? It's clear as day. You take too many calories, you don't spend as many, and therefore you have a weight problem. And so, even though that may be not outside of the knowledge of these women, it's more complicated of a thing than just that. And so I wanted to also, as a background, tell you I did a study in Tallahassee, Florida, with African American women. Same, looking at causal explanations because same, weight is an issue. It's a big issue for that population of African American women. And so that's available. And I don't know how I can drop a link for that paper, but I will be glad to provide it should you be interested. So, what we found is that there is a profound lack of support for women when it comes to weight decisions or prevention decisions, namely from their family and significant others who, you know, about half of the time or the majority of the women refuse to eat healthier, so to support the women. Another way that there's lack of support is by being the recipient of put downs, pejorative words such as animals, pig, whale, etc., or gorda, or any of these words that are not fatal, but they're not compliments. All right, so this kind of bullying is, by the women's description, not uncommon. Also, I don't want to say sanctioned, but you know pretty well accepted and generalized. And so, given those things, and the another thing that I thought was interesting, well, two things, is that the women were not really keen on overweight as a real problem. They were more obese, yes, but overweight. They use attenuating words like instead of gorda, gordita, a little over, things like that. So, like, to minimize the problem. The other is that most of the women had not been spoken to by their physicians regarding what to do, about weight or what had caused it. And so these are critical areas in which nurses, can definitely do the connection, if not with community health workers, which I think would be a really good program to begin a collaboration with. So that's it for me. I'm Dr. Ivette Lopez over at Public Health, I'm also the director of the Utah Area Health Education Centers. And so happy to be there with you tomorrow or Wednesday. I'm not sure. But anyway, thank you so much. Bye-bye.